Hello, this is Dr. Trivedi, a doctor working here in this clinic. May I confirm your name and age, please?
Hello, doctor. I am Christian Bale and I am 68 years.
How may I address you?
Doctor, please call me Bale.
Okay, Mr. Bale, how are you doing now?
I'm okay, fine. Oh, fine. Just this episode that I have some loss of consciousness that persisted only for a minute, and after that I am quite fine. I don't have any problem, but I'm really worried
Okay.
about that.
Yes, yes. Well, today I'm going to discuss about your health issues. Will that be all right?
Yes, doctor. I really want to know what is happening with
Okay,
me.
okay. And during our discussion, I might take down some notes, which will be strictly confidential. Will it be all okay?
Okay, doctor. No problem.
Okay. Now, Mr. Bale, can you please tell me in your own words what actually happened to you and what brought you here today?
That was the event was 3 days ago. That I was playing a squash with my friend in the afternoon, and at that time, suddenly I noticed that I am being somewhat hot and flashy, and suddenly I don't know that what happened. I collapsed down, and
Okay.
after I think about 1 or 2 minutes after that, I regained consciousness, and I discovered myself lying on the ground, and my friends were pouring water on my face at
Yeah.
that time. I really was worried about this because this type of episode also happened once before. So I am thinking that if it is a serious thing or not. Then I visited my GP, and he said that this might be a he said that something hypertrophic obstructive cardiomyopathy, because my father had this disease. He is also thinking that I am having this disease, and he promptly referred me here.
Yes, yes. Okay, I can understand. I will try my level best to find out what actually caused your problems. May I know that you told that this type of event occurred once before. Can you please tell me when actually that happened? That previous
Uh,
episode,
that was about 5 months ago.
about 5 months ago.
Yes.
Okay. Well, do you think that episode and this episode have been different or almost same?
At that time, doctor, I was at market, was buying something for my house, and at that time I suddenly collapsed down.
Okay. Well, at the time, how did you recover? Can you remember?
I fell down on the floor, and after about that was also about half a minute, or after 1 minute, I regained consciousness, and I
Okay.
myself discovered myself on the floor.
Yes, yes, yes. Okay. Well, now let's come to this to the latest episode. Now, just before this episode, loss of consciousness, um, uh, realize anything abnormal, like any lightheadedness or blurring of your vision or vomiting, anything like that?
No vomiting, but I felt somewhat nauseated before the onset.
Okay, okay, that's all right. And did you feel any hunger at the time?
No.
Okay, any sweating?
Yes, doctor. I was sweating.
Okay,
I was sweating mass at the time.
okay. Could you please tell that whether you felt any racing and pacing of your heart at the time?
No.
Okay, and any chest pain at the time?
No.
Any shortness of breath?
No.
Okay. May I know that who were with you at the moment you collapsed?
I was playing football, and my friends were surrounding me.
Yes, yes, that's okay. Could they could you know or had they told you anything about you bit your tongue or not, or you wet your clothes during that episode?
No, that they only said that I became somewhat pale during that episode.
You became pale. Okay. Did they notice any shaking of your limbs or anything like that?
No, they didn't
Okay.
say anything.
Yeah. That's all right. And just after you gained consciousness, you told that you gained consciousness within a very short time. I think within 1 minute. Am I right?
Yes, doctor.
Yes. And after that recovery, did you feel any? Did color change? Did your friends notice that you changed your color, like any
No,
flushing or something like that?
after regaining consciousness, I was completely fine. I didn't find anything no abnormal with me.
Okay, that's all right. And okay, that's all right. And may I okay, and may I know that in the previous episode that you told, were you almost the same that you felt any previous warning shots in the
No
previous
warning shot.
episode?
No warning shot. Suddenly, I felt that I am becoming warm and
Okay,
fleshy, and at that time,
mm.
suddenly I collapsed.
Okay. Any racing and pacing you felt at that time?
No,
Okay. Well, may I add some other questions that did you feel any abnormal sensations, any abnormal sensations before that episode at either time?
somewhat tingling that might be, but I don't think that was so much severe or bothering.
Okay. Well, any neck pain did you feel
No,
at that at any episode?
no,
Okay. Any okay. And may I ask you some other questions that did you ever measure your blood sugar level in any of the episodes?
no. I don't have any problem with my blood sugar.
Okay, okay, okay. Start forever. Okay. Well, may know that do you have any chest pain?
No,
Okay. Any shortness of breath?
no,
Okay. Any racing and pacing of your heart
no,
anytime?
doctor, no,
Okay. And may I know that do you have any chest tightness?
no,
Any noisy chest?
no,
Okay. May I know ask you some other questions now? Do you have any headache?
no, doctor,
Any changes in your vision?
no,
Any oral soreness?
no,
Any joint pain?
no,
Any rashes anywhere in your body?
no,
Okay. Any weakness in any parts of your body at any times?
no,
Any changes in your sensation?
no,
Okay. And okay. And may I ask you that do you have any raised temperature?
no, doctor,
Okay. Any loss of weight?
no,
Okay. Any loss of your appetite?
no,
Any weather preference? Any hot or cold preference?
no.
Okay. And may I ask you that what about your water work? Has it been all right?
Yes, doctor, I haven't noticed any signs.
Okay. Any frothiness on your water work?
No,
Okay. Any frequent any poor streaming or any dribbling in your water
no,
work? Have you
not like
noticed
that.
anything? Okay. Okay. And what about your bowel movement? Is that all right?
I think it is quite normal.
Okay. Have you ever noticed any blood in your bowel movement?
No,
Okay. Any episodes of bleeding from anywhere in your body?
no,
Okay. And may I ask you that have you been diagnosed with any chronic disease at any time, like high blood pressure or
yes,
a high
doctor.
blood
I,
sugar?
I, I I have high blood pressure for last 20 years, and I am taking bendroflumethiazide and pramipil for that.
And I feel for that. Okay, that's all right. May I ask you that actually, for how long have you been taking these medications?
Ramipril for 20 years and bendroflumethiazide that was added about 3 years ago, and last year the dose was
Yes,
increased.
last year it was increased. Okay. And after that increase, did you ever go for any checkup? The dose increase?
I usually go to regular checkup, and my
Okay.
blood pressure is under well controlled.
Okay. When was the last checkup?
3 months
Can
ago.
you remember? Sorry, 10 months ago.
3 months ago.
3 months ago. Okay. Well, was their blood pressure well controlled then?
Yes, doctor.
Okay. And may I ask you that do you have any problem? You told that you don't have any problem with your high blood sugar, and do you have any problem with your cholesterol levels? Have you noticed any?
No,
Okay. Did you ever had any heart attack? Do you know? Do you
no,
remember any stroke or anything
no.
like that? Okay. And do you have any family history of any heart diseases? You
Yes,
told
doctor.
that
I
one.
told her
Yeah.
that my father had hypertrophic obstructive cardiomyopathy, and he was diagnosed when he was at his age of 35.
Yes. I Okay, you told that your father had this problem at 35. May I know that after diagnosis, his diagnosis, how did he do? Did he do well, or how
He
which
was
treatment
he
he
was
got?
he was on treatment. He took some medication, and after that, at age of his 50, he needed surgery for that.
Okay, and after that, how what happened to him?
He was totally fine, and he died at his 70.
Okay, may I know that have you ever done uh, any the scanning of your heart
No,
since you?
doctor, I am afraid that if I know that I am having this heart disease, I always feel that worried. If I yeah for that I didn't seek any medical attention for that, or my previous doctor also advised for going check up if I am having this disease or not, but I didn't prefer that.
Yeah, yeah, I can remember. Okay, well, may I just ask you some questions? You told that you don't have any shortness of breath, but may I know that do you have to use any extra pillows at
No,
night to be more
no,
comfortable? Okay, have you ever noticed any swelling in your legs?
no,
Okay, I'm sorry to interrupt you. Now let's go to your medication history. You told that you take these drugs, this thyroid and uh, Ramipil, I think. Do you take any other medication?
no,
Are you allergic to any medication?
no,
Any over-the-counter medication or herbal medication?
no.
Actually, I'm very sorry to ask you, but may I ask you some personal questions regarding medications?
Okay.
Have you ever taken any recreational medication? I'm very sorry to ask, but
No,
may I ask?
never.
Yes, yes, I'm very, very sorry. And may I ask you some other personal questions as well? Do you smoke cigarettes, Mr. Bale?
No,
Very appreciable. And do you drink alcohol?
no, doctor. I lead a very decent life.
Oh, that's very, very appreciable. And may I know that whom do you live with actually?
My wife.
Okay. Uh, and are you well supported economically and financially and
I think
socially?
so. I think so.
Okay. And may I ask you, where do you live? In an old house or a flat or apartment? What is this?
It's a flat, doctor.
It's a
At the
flat.
seventh floor. Yes.
Well, okay, okay. Do you have to use stairs to get into the flat?
Yes, doctor.
Okay. I think that we might involve the social services in this case to look into whether your flat is is good for your health regarding your health condition or not. Okay, will it be okay?
Okay.
Okay, and uh, okay, and may I know that what do you do for a living now?
I'm a retired person. Previously, I was an office clerk.
Yes, okay, that's all right. And may I know that do you drive?
No,
That's all right. And may I also ask you some questions that have you been to travel to any other country recently?
yes, doctor. 6 months ago, I went to America.
America. Okay. May I ask you that whether it was a long flight or not?
Long flight. Of course, a long flight. 12 hours.
Okay, long flight. Okay. May I ask you some questions? I'm sorry to actually ask you now, but may I ask you that do you have any cough?
No,
Okay. Have you ever coughed up blood?
no,
Okay, that's all right. And have you ever had any problems in your blood channels like blood clotting or something like that?
no.
Okay. And you said that you went to America around 6 months back. But can you please tell me that where did you stay in your during your travel, or where did you visit in America?
I pay a visit to my daughter.
Okay. And during that time span, were you all right
Yes,
physically?
doctor. I was all right.
Okay. Okay. And Mr. Bale, may I ask you what your concern is?
Doctor, I was quite fine before these two episodes, and my GP is thinking that I am having this obstructive cardiomyopathy. Do you think that I am having that, or
Uh,
do I need any specific medication at this time?
Okay, Mr. Bale, actually, at this moment, it's quite difficult to be completely sure about about your disease condition. But I will have to first examine you thoroughly and then assess you by doing some blood tests and also doing some scanning of your heart. Okay, and after that I can give you a far better explanation. But as long as I have taken your history regarding your age, I think that uh, there are some possibilities of your symptoms. Okay, I cannot deny that what you suspect obstetric cardiomyopathy, it can be a possibility. I cannot deny. But regarding your age, I think that it might be a bit unlikely. However, we have to be completely sure about that by doing the scanning test. But what I think that you might be affected some other condition. I think we have to take it under consideration as well. It is actually called aortic stenosis. I think this can be a cause of your problems. We are not completely sure now. We will have to do some scanning, but we will involve our heart doctor regarding this. And if it is true, or if it is the fact what we are suspecting, then you might have to review your medication again. Are you getting me, Mr. Bale?
Yes, doctor.
Yes, at that time we might have to review your high blood pressure medications, because some of the medication might be a bit harmful if this condition is diagnosed. Okay, and we might have to review your medication, and we might change it again. And so I think that will be important, and we will also involve our social services to have a look into your home condition, whether it's all right for your health or not. Are you getting me, Mr. Bill?
Yes, doctor.
Do you have any more concerns?
No.
Uh, okay. Any more questions, Mr. Bill? Do you want to know?
Just one thing. Is it a curable that you are suspecting this condition?
Uh, okay, Mr. Bill, actually, what we are suspecting at this moment, we will actually have to do some tests. Okay, and if the test results suggest that it is actually quite harmful, we might go for some treatment, which can be medical treatment, or sometimes we can also do some operative procedures as well. We can suggest. So, however, it might be, it will depend upon your disease condition, on which scale, how much severe it is or not. So these things might determine whether it is completely treatable, or we have to keep it under control or not.
Okay,
Are you
thank you,
getting?
doctor. Yes, doctor.
Okay, okay, okay.
So present your case.
A patient, Mr. Bale, he presented with actually loss of consciousness for twice actually. This time he while having loss of consciousness, he was playing squash, and the previous episode he was doing some marketing, I think. And both of the times he went pale during at the time of attack, and regained his consciousness quite quickly. And after that, he got flushed out, flushed, and there was no residual confusion or anything like that, and no tongue biting, urinary incontinence, or shaking. And his blood glucose level was also normal. Uh, his blood was also normal, and I think that excluding all other conditions, and actually he didn't present with any other cardiac or respiratory symptoms or any other symptoms, I think. Although he has history of high blood pressure, for which he has been taking both ramipil and thiazide. So I think regarding his symptoms and his symptomatic analysis, I would think that his most probable diagnosis would be aortic stenosis, I think.
Do you have any other differentials diagnosis?
Uh, I think he might be suffering from vasovagal syncope as well. Vasovagal syncope, and I think and what he told that his father had hypertrophic obstructive cardiomyopathy. He can also suffer from that condition as well.
Okay. Can it be a case of postural hypotension?
Yes, it can be, but actually,
Okay, you said that your first differential was aortic stenosis. What was
Yes.
the points in favor of that?
Actually, I think that is repeated episodes of this loss of consciousness, and second, especially the second episode, while being physically active while playing squash, that I think was an important indicator in this patient, and also that he's taking off Ramipil for quite a long time. This can also be a precipitant for this condition.
He doesn't have any other history suggestive of that, because he doesn't
Yes,
have
yes,
any history of chest pain or any shortness of breath.
yes,
Do you
yes, yes.
consider any other differentials as the most probable diagnosis?
Yes, I think vasovagal syncope can be also be a very important differential here.
Okay. Vasovagal symptoms. How will you exclude vasovagal syndrome?
I think I will have to do Holter monitoring, and then I will have to do some specific tests. I think some maneuvers. I have just forgotten the name.
Tiltable test. Okay.
Sorry,
Then,
tiltable test. Sorry. Yeah.
then
Tiltable test, and then I sorry, I can't remember now.
okay, not a problem.
Hello.
So in the history taking, you were totally good. Everything was fine. Just I cannot remember if you have asked about any history of postural, any symptoms suggestive of postural row.
No, I didn't ask. I forgot.
Yes, this was the thing. And another
Yes.
thing, if he had got any injury on the fall,
Yeah, yeah, yeah. Yeah.
otherwise everything was fine, I think.
Yeah.
And,
But I think I need the diagnosis. Okay, am I right?
and there was something that you asked something later about, that is, you went for the drug history later and came for the family history first.
Yes, yes.
Otherwise, everything was fine, I think.
Well, I think I need the diagnosis. Is that right?
Okay, well, I think these symptoms and histories are more suggestive of diagnosis of
Yes.
vasovagal syndrome.
Yeah. Right.
Vasovagal syncope, everything can explain vasovagal syncope. And
Yeah, yeah.
aortic stenosis, these patients have exertional dyspnea, chest pain.
Yes, yes, yes. Actually, I was I was thinking about that, but okay, that's all right. Well, and any other? Are you? I when I told that there was tiltable testing, and what others? I just forgot. Can you please tell me?
Okay, there are some routine investigations, then cardiac investigations like ECG, chest X-ray, echocardiogram.
Yeah, yeah,
Then, if needed, go for the tiltable test and Holter monitor or event recorder. The event recorder isn't
yeah,
necessary because this is not a frequent episode.
yeah, yeah. So, but I think I should mention that name 24 hour or alternate if needed.
Okay.
Okay. Okay. So, thank you. I think so. I think there is any other person I think involved here today in the discussion.
In loss of consciousness, you did well. And I would like to add one few more points. In case of loss of consciousness, you have to add the differential diagnosis from head to foot like that. For example, from the CNS, apart from funny terms like seizures, you should add the transient ischemic attack and syncope. It is a broad topic actually. It's not only vasovagal. It's a syncope has been classified into some three categories. Among them is vasovagal, reflex syncope, situation syncope, and
Mm.
it's a different types of syncopes.
Yeah.
And then if you come down, then there are postal syncope. It may be secondary to that, depends upon the uh, while patients are having syncope at the time before prior to the syncope. Is there any history of sudden turning of head to the left or right? left or right, and is there any history of shaving? Because sometimes the condition is hypersensitivity reactions might present with a syncope, or the patient is lifting some heavy object from above, just above his shoulder. That may cause subclavian steal syndrome. That also presented with this syncope. And then if you come down, then you can add this CVS and the RS. What CVS we know, apart from this HOCM, is there any atrial stenosis, pulmonary hypertension causes, and valvular causes obviously stenotic lesions, say like valvular, subvalvular. And valvular means aortic stenosis. Subvalvular in the sense it may be hypertrophic obstructive cardiomyopathy. If patient is having shortness of breath, chest pain and exertion, and sudden onset of syncope, then we can suspect that patient may have this aortic stenosis. If post-exertion patient is having syncope, then we can suspect HOCL. Apart from these two, then pulmonary hypertension, primary pulmonary hypertension or secondary pulmonary hypertension, also one of the cause for the syncope. And apart from this, any valvular issues like mitral stenosis associated with atrial fibrillation, and also for regarding CVS, you can add them into differentials. And then if you come respiratory wise, and obviously we have pulmonary hypertension, pulmonary embolism, and then what else? And then if you come down a little lower, and you can have this endocrine process like Addison's disease, and diabetes mellitus, and even pheochromocytoma also associated with anxious sweating, palpitation, and in syncope. And then apart from this, adrenal and pheochromocytoma, and then insulinum also associated with the giddiness and fainting and giddiness, and even syncope that we can add, and then dizziness. And then if you go down, then even the hypoalbuminemia causes also associated with syncopes, like nephrotic syndrome, BCLDs.
Okay.
Those things also associated with syncopes. And you can add from head to foot, we can add them into different shades. So in your case, you're thinking would mostly the vasovagal, right?
Yes.
And yeah, in that aspect, then apart from those, so always start from the initiations, like the baseline initiations first, and then specific blood initiations second, and then imaging studies, and then would like to if you would like to intervene in interventions like catheter interventions, something like that, and then put it into the last session. So first, basic baseline initiations like full blood count. What are the things you want to see in the full blood count in syncope patients?
Anemia.
Yeah, anemia. Why don't you think eosinophilia in these patients? Because Addison's patients will have eosinophilia.
Yeah.
So anemia, thrombocytopenia, and as well as this what do you call the thrombocytosis and polycythemia, and then eosinophilia. These things you can expect. Why thrombocytosis is associated with the the thrombotic episodes, and then polycythemia also associated with this thrombotic episodes, and then eosinophilia is associated with this Addison's disease. Anemia obviously associated with this. There are other options like hemoglobin associated with syncope, and as well as aortic stenosis associated with angiodysplasia that may cause bleeding in the cataract. That also associated with this, the hidden process of anemia. And then you are going to do renal function test with electrolytes. Okay. In renal function test, urea, creatinine, if in case of CKD patients, end-stage renal disease patients, they have this, volume overload status with some amount of syncope, and as well as the electrolyte dyselectrolytemia cells associated with the syncope, especially hypocalcemia and hyponatremia, and okay. And if we go for liver function test, obviously hypoalbuminemia. And if you apart from these illustrations, any special illustrations would you like to do? Yes, at the time of regarding cardiac, ECG, echocardiogram, what else you want to see in the ECG? You can tell them long QT, Brugada syndrome features, or long QT syndrome features, or epsilon waves features for ERVD, or deep TV inversions regarding HOCM, okay, or bundle branch blocks, or fascicular blocks. Okay, would you like to? Why do you want to see fascicular blocks? I would like to compare from the previous ECG to the now, so that the fascicular block is increasing. Initially, it may be bifascicular block. Now it has been degenerating to trifascicular block. So I would like to compare the previous ECG versus the current ECG, and then echocardiogram. Obviously, we know to rule out valvular lesions, subvalvular or valvular lesions, and then even atrial fibrillation also missing. And then if nothing for WPW syndrome, obviously I missed that. WPW syndrome associated with the syncope. And then for echocardiogram, I would like to see valvular and subvalvular lesions, like especially outlet tract stenotic lesions, like aortic stenosis or hypertrophic HOCM, supravalvular lesions. Even coarctation of aorta is associated with syncope. And then pulmonary hypertension is associated with syncope. Okay, and then I would like to proceed with other investigations, like special investigations like treadmill test. Because in HOCM, if you do treadmill test, patient will land up in the PSVT. That is an indication for the surgery actually. Or if you do treadmill test, if there is a drop in blood pressure of nearly 30 millimeter mercury, then it's another indication for the surgery. Okay, and then if nothing found in the rest ECG as well as the treadmill ECG, then the event is monthly once, means then I'll put him on loop recorders. It may be internal loop recorder or external loop recorder. If the event is frequent, maybe weekly once, means then I will put him on external loop recorder. It will find out. If the event is very rare, like monthly once or 2 months once, means then I will put him on internal loop recorder. Okay, regarding this, and then if then that also is not foundable, then I would like to differentiate between the cardiogenic syncope versus neurogenic syncope. Then I like to put him on tiltable test, where I will use this MTG tablets, nitroglycerin tablets, to induce the syncope, drop in blood pressure. If patient is withholding, then obviously cardiogenic has been ruled out. Then I will label him as neurogenic syncope. If patient is having drop in blood pressure significantly with symptoms, then I will put him on cardiogenic syncope, okay, rather than neurogenic syncope. And to rule out the neurogenic syncope, I would like to do electroencephalogram and CT or MRE, brain plane study, and then carotid Dopplers, carotid as well as vertebral Doppler study to rule out this vertebral basilar insufficiency. And then also look for a Doppler study the subclinic to vertebral basilar artery to rule out the subclinic still syndrome. And then for neurogenic it is okay. And then I would like to run few illustrations related with this based on the basic illustrations output. I would like to run few more illustrations regarding endocrine. Like if patient is having low sugars, means then obviously I would like to rule out this insulinoma and then Addison's disease. So based on the specific stations, I'll put him on. I would like to rule out this insuloma as well as this Addison's disease, as well as I would like to look into the chart if patient is on long-term disease like diabetes mellitus. If patient is on diabetes mellitus, okay, because it can be drug-induced as well. Okay. Obviously, to rule out these things, regarding this insuloma, I forgot the test. Like some, we'd like to load him on some oral. What is that, Maniraj? I forgot that insuloma test. That we need to load him on some
prolonged
75 gram
prolonged fasting test.
prolonged fasting with serum C-peptide, right?
Yes, prolonged fasting with serum C-peptide level with serum insulin level.
Yes, 72 hour fasting, I think. 72 hour fasting with
Right.
level.
Very good, correct. Yeah. And 72 hour fasting with serum C-peptide level to rule out this insuloma. And then Addison's disease, obviously, we know that, it's not in this test. And then for regarding pheochromocytoma, obviously, we need to do 24-hour metanephrines, urine metanephrines. So we'd like to put the chart like this. If you're very sure, because always try to give differential diagnosis, because we do not have the single answers. Even though if you have single answers, always put the differential diagnosis, because differential diagnosis has marked more than the diagnosis.
Okay. Okay.
And one thing that in the vascular history, you should have asked about the hot and humid weather, surroundings, prolonged standing during that time. You have missed that.
Yeah, but what was the evidence? Is there any person standing nearby to the evidence who has brought him to the hospital? In that on, we should ask the guy who is standing next to the patient, like, is there any tongue biting? Is there any incontinence? Is there any jerky moments of?
Oh, he asked us. He asked us.
Yeah.
Mhm.
Okay, fine.
Okay.
Next case.
Yeah.